Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, CEO of Roots Community Health Center, reporting for the week of December 7th. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise and give you the information you can use to keep yourself, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though this pandemic is worldwide, the effects are very different depending on where you are, so we are here to give you up-to-date information about Oakland and East Oakland in particular. Alameda County now has over 32,000 coronavirus cases, and there are 520 COVID-related deaths. Now, the top 3 zip codes in the entire county in terms of both case rates and positivity rates are all in East Oakland. They are 94601, 94603, and 94621. And when we add up total cases for these 3 zip codes, it comes to about 57% of Oakland's cases. And Oakland has more cases than any other city in Alameda County. And when we look at the population in these 3 zip codes, it is actually only 28% of Oakland's population. So in other words, an area that is only 1/3 of the population of Oakland has had almost 60% of Oakland's cases. So the bottom line is the virus is hitting Oakland harder than most parts of Alameda County, and it is hitting East Oakland even harder. Now let's take a look at daily cases. As you can see, daily cases are rising sharply. They are rising at a very worrisome rate. The tall bar to the right here is showing numbers for December 4th. So this isn't quite reflecting transmission for the holiday weekend just yet. If you got COVID on your way back from traveling on the Sunday after Thanksgiving, when over 1 million people were traveling through U.S. airports, your test would be just turning positive right around the 5th or later. So this graph here does not reflect holiday activity yet, but you can see that it is already going sharply up. Now let's take a look at hospitalizations, which is even more worrisome. As you can see, hospitalizations continue to increase, and we see a very steep slope here, heading in exactly the wrong direction. In fact, we have not seen this many COVID hospitalizations in Alameda County ever. That's right, since the start of the pandemic, we have not had this many people in the hospital with COVID-19. Our peak was 213 back in July. Now we have surpassed that by 14 people and are at an all-time high of 227 people hospitalized with COVID-19. And this really does not reflect the holiday weekend. We don't expect to see the impact of the holiday weekend on our hospitals for about another week or 2. So when will cases and hospitalizations peak? Could it double? Could it triple? Yes, it could quadruple or even worse. There's really no rules or parameters to this. There's basically no limit at all until everyone has been infected. And even then, there are documented cases of the same person getting it twice, or people bringing it in from another area. So basically, I'm sorry to say, but we have a ways to go and no end in sight. So in the midst of this thing really raging out of control, we get some promising news about the vaccine. There are a few of them out there now, and no doubt there will be more on the way. So now most of what I'm hearing about is about the vaccine. There is this great hope that the vaccine means the end of the pandemic. Does it? Well, I certainly hope so. But there's a lot that has to happen before we get there. First, let's forget about how good the vaccine is just for a second. Actually, let's say the vaccine is perfect. Well, even then, it will likely be months before it will be ready for you. It's getting distributed from the manufacturer to the feds, to the states, and then from the states to hospitals or other facilities, either directly or by way of the counties. And there will be some prioritization based on your risk of getting it and your risk of dying from it. So if you are a healthcare worker in a hospital, or a skilled nursing facility, or if you are a resident of a skilled nursing facility, you may indeed be offered this vaccine within the next month or so. But for most of us, we will not be in this first round, so please relax and let's settle into the reality of the situation for a minute. So far, what I'm hearing is people jumping to one end of the spectrum or the other. Either I am never going to get that vaccine, or they better give me that vaccine. I have a right to that vaccine. And I hear you on both of these points. We do not want to be guinea pigs, and we don't want to get left out either. But again, the best thing I can tell you for the moment is please relax and settle in, because you are very unlikely to have to actually act upon either of these sentiments anytime soon. The simple fact is that we still have some things to do and we still have some things to learn. Most likely your doctor's office or clinic will not have it for distribution for at least a couple more months. So in my opinion, the best we can hope for right now is that by the time the vaccine is available in our hands, ready to be offered to you, we will have answers to your most pressing questions, so you can therefore make your most informed decision. So what is most important about the vaccine itself? Two main things: safety and efficacy. First and foremost is safety. Is this going to hurt anyone? Second is what we call efficacy, or will it work? And within that, will it work? How well will it work? For how long will it work? So far, things are looking pretty good on the safety front, but we will know much more once the vaccine is used on a more widespread basis. And the UK is rolling it out as we speak, so we will be keeping a very close eye on how it's going there. So regarding safety, so far so good, and we will keep monitoring that closely. Now, efficacy, does it work? Well, the numbers we're hearing out the gate sound wonderful. 95, 96% or better, that's great. Now, how long will that last? How many doses will we need? We don't know all of that right now. The vaccines that are out right now require 2 doses, 21 days apart. Will we need a third dose in 6 months, in a year? Will it be a yearly shot like the flu? We just don't know any of that yet. We need more time and more studies under our belt to know that part. We do know that it's possible for the same person to get COVID-19 twice, so even natural immunity is not completely protective. Will the vaccine protect you more than natural immunity? We don't know that yet either. Can COVID mutate and therefore the vaccine wouldn't be effective, or we'd need a new vaccine to adapt to that mutation? Again, we don't know all of the answers to all of these questions just yet. But these things are knowable. We will know more with more time and more experience under our belt with this vaccine. So, like I've been saying since the very first briefing, no one is coming to save us. We must save ourselves. This goes for the vaccine too. This is not a magic bullet. We must do what we know works while we wait for what we hope will spell the end of this crisis. So, what works? First off, I'm sorry to say, shutdowns work. And I want to commend our county health leaders for continuing to have the courage to implement these measures. It is not easy. There are terrible trade-offs with the economy, with our schools, with our businesses, but these trade-offs are not as terrible as the loss of life and the devastation we will see if we reach that tipping point of overwhelming our hospitals. Now, let's face it, countries that have been able to get this thing under control have done so by shutting down their borders and imposing real lockdowns. We have not been able to do that in this country, and we likely will not be able to do that. So it is up to each and every one of us to do our part. So I am sorry to say, but it is back to basics. Shelter indoors as much as you can, whenever you can, but only with members of your household. Don't share your air. Mask up and space out. Protect your elders and those with underlying conditions. If you think you were exposed, quarantine yourself. Get tested in 5 to 8 days after your exposure, and continue to quarantine yourself until you get your results. If you have symptoms, do not go to work. Do not get into close contact with others. Get tested and quarantine. And now I'd like to share some footage and input from our COVID testing site on 99th and East 14th.
Once we in the area of the hot zone, we stay in the hot zone. Everything must come off before we even enter the building. And people that's being, we really strict, even on clients that comes, you must be 6 feet apart. If we see any people within that 6 feet, we actually, is you guys together? If not, can you guys please separate? And we actually have people move further distance from each other.
How has the surge in testing changed things for you personally?
Personally, it has changed my attitude and people around me, their attitudes, because now we're just so cautious about everything. We're constantly, like looking. You got this, you got the hand sanitizer, you got your gloves. It's a whole different thing now that this pandemic is spreading, and I just really don't know why people are not getting tested. Because I live in a hot zone. I live in the 94621. And I'm constantly telling people every day when I see them, my neighbors and all of them, please come and get tested. We live in a hot zone. Because just because you don't have it don't mean your next door neighbor don't have it.
What brings you in to get tested today?
I'm trying to check on myself, see if I got it or not. That's all. I'm trying to be safe around here.
I appreciate you. Thank you so much.
No problem.
And now here's our best advice one more time. We are encouraged by the vaccine developments, but it is not going to be the end all to all. We must do what we know works in the meantime. Shelter indoors as much as you can, whenever you can, but only with members of your own household. Don't share your air. Mask up, space out. Protect your elders and those with underlying conditions. If you think you are exposed, quarantine yourself. Get tested in 5 to 8 days after exposure and continue to quarantine yourself until you get your results. If you have symptoms, don't go to work. Don't go around others. Quarantine yourself and get tested and stay quarantined until you get your results. That concludes today's People's Health Briefing. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.